Hi, this is David He. I'm in South Korea, Seoul, Gangnam district in Seoul, Korea. As you know, the Koreans are very famous for K-beauties, K-pops, and Samsung Semiconductor Industries, and Hyundai Motor Company. We're gonna start from the cosmetics and K-beauties. For Korean women, they're very interested in their beauties, and I think the Korean women are the most beautiful women's in Asia. Especially when we compare it to other countries, the Korean women are very interested in their uh, appearance, how they look like, and how they how they are looking to the others. So the cosmetic surgeries and very good cosmetic products are very popular in Korea. We're gonna start from the fillers today. About the fillers are the basic compound of the collagens. The collagen is the material that is constructing our skins and subcutaneous tissues. Okay, so that is very important for making you look younger and much more beautiful. If you lose collagens and lose elasticity in your skins and your face, it can make you look a little bit more older, and it can make your face a little bit unbalanced. So we're gonna start from the anterior cheekbone area fillers. These fillers are very safe because there are no critical vasculatures that can harm your health or that can be obstructed through the filler therapy. So it is very safe. The most dangerous filler area is the nose filler. So for the nose, there are two major arteries that can be connected to the ophthalmic arteries that it can make kind of a blindness or major side effects like infarcts or vascular occlusions. But for the anterior cheekbone area, it is very safe. There is no critical vasculature that can affect your critical conditions. So we call that the anterior cheekbone area fillers as an Indian filler because it's a nickname. Because as you know, when you see the Western movies, the Indians camouflage them and paint their face like these lines. So the fold that is appearing when you're getting older at the anterior cheekbone area appears like this. So its nickname is Indian filler. It's just like an Indian's face painting they do before the wars or battles. So, and the Indian cheek filler is inserted through here. We use the cannulas. The cannula is kind of a needle that has a blunt end, and its diameter is a little bit larger than the conventional needles, the sharp needles. So we put the cannulas through here and fill every anterior cheek area with this one hole. So it is very safe, it is very convenient, and it takes only about 5 or 10 minutes for the therapy. So after 5 or 10 minutes therapy, you can see these Indian folds, the anterior cheek area folds filled with the fillers. So it's very safe and convenient. And the elasticity is getting decreased. The Ulthera therapy, the lifting therapy, can be also very beneficial. It's very good for your face too. Because the folds appearing right here has two causes. First one is the fat tissues around here is getting diminished, is getting decreased, or the volume of the fat tissues is decreasing when you go older. And another reason that you can see the Indian fold is your skin is enlarged. The saggings appear. So the saggings means that the surface area of their skin on the anterior cheekbone area is increased. The surface area is increased, so it can make a folds or some dimples. So that's why we use the orthotherapy. The orthotherapy for the anterior cheekbone area folds, because every folds has the enlarged skin surface area, so it can be very beneficial to use the orthotherapy. Orthotherapy is ultrasound sonotherapy that can shrink your skin surface area. So it is very safe. It doesn't have any side effects. But if you are not done properly with a proper surgeon, maybe the side effects can appear. For example, the numbness of the face around your mouth area is a very common side effects, because it can stimulate your sensory nerves around here, so it can make your sensory or motor change in your mouth area. So that's the only side effects that can appear after the orthotherapy. But the instance is very rare, so you don't have to worry about it. Okay. Today, we have explained about the anterior cheekbone area fillers, and it's very good for making you look much more younger and much more beautiful. Because if your anterior cheekbone area is flattened, your face can look a little bit wider, and it can look like much more flat face. And if you have any time to visit Korea, please visit our clinic, and we're gonna make a consultation for you for making you much more younger and beautiful. Thank you. This was the Sonyoung in Kangnam, Seoul, South Korea. Thank you very much.